Hello, everyone. I'm Janelle Mose, the Advocacy Director with AARP North Dakota. AARP has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP has canceled all of our in-person events until the end of the year, but we're finding other ways to help provide information and resources to help older adults and those caring for them. Thank you for joining us for part 2 of a series focused on the impact of COVID-19 and the risk of social isolation and loneliness. If you joined us for part 1, the focus of our conversation was on finding meaningful and productive ways to stay socially connected to family, friends, and neighbors during this time of physical distancing ourselves from others. With me again today is Katie Jonke from Bismarck Burley Public Health and Chandra Zeman-Belinsky from NDSU Extension Burley County to highlight the signs to look for if you are isolating and feeling lonely and steps you can help take to support yourself. Welcome, Katie and Chandra. Thanks for joining me this morning.
Thank you for having us.
Hi, Janelle. Yeah, thank you.
Good to see both of you. So Katie, let's start with you. So starting back in late July, coronavirus cases started to slowly rise and have continued to rise in many counties, including Burley County. The governors adjusted the risk levels in counties like Burley County, and a task force is engaged in efforts to provide education to community members about how to stay safe. We know that many residents are still practicing social distancing and isolating at home, especially those older adults that are at risk. Education and awareness is so key to understanding how to navigate our way through this pandemic. To start with, Katie, can you provide us a quick update about what's happening in Burley County and remind us about the differences between social distancing, quarantine, and isolation?
Yes, absolutely. So I'll start off with those definitions first, just to put it into context. So social distancing should be thought of more as physical distancing or separation than that social isolation. And so really think as a way from separating from others or interacting closely to mitigate the spread of the disease. So large gatherings may be canceled or attendance reduced to help with that. Quarantine is going to be the separation and restricting the movement of people that have been exposed to COVID-19. So think of a close contact would be one that would maybe have to quarantine to see if they become sick. It lasts long enough to ensure that they have passed the transmission time frame and the exposure to the exposure to the disease, and if their symptoms have not happened. Where isolation is going to be the preventing the spread of the infectious disease, so the case for COVID-19, the person that has had the disease, and preventing them from spreading it to others in the community. And so we would want to isolate them from spreading that. And so those are those definitions, and I think it is important to understand. Some people kind of use them interchangeably, but the education piece for those is really key to understanding how we want to navigate this disease. And right now in Burley County, we really are trying to just understand the areas that are maybe hotspots in our community, what groups might be spreading it, and what we can do to help educate the public to have personal responsibility and keep the health and safety of our community at the utmost importance. And so encouraging mask use and recommending physical distancing if you are out and about in public. And so it's not that you can't engage with others, but just do so mindfully and have that physical separation and wear a mask when able.
I think those are really important tips. And, having kiddos in school now, my son, it's become so natural to him. I'll pick him up after school and he'll, put hand sanitizer on and he'll put his mask back on just because it's such a natural thing to him now. It's just part of his daily routine. And I'm like, well, Eric, we're going home. So I think with practice, and I think these important, health tips will really get us through this time, and hopefully we'll start to see better days ahead of us. But, with that in mind, Chandra, and with COVID-19, the risk of infection brings obviously social isolation and loneliness. Older adults, most vulnerable, they're living alone, no close family or friends, often homebound. Can you talk about how recognizing and understanding those feelings in yourself is really a first step if you're feeling isolated or lonely?
Yes, Janelle, thanks. So let's do just that. And, let's talk about a few examples related to what we might feel, anxiety, worry, or fear about your own health status, or those that you love, the health status, of others who have been exposed to the disease in general, the resentment that your friends and family may feel if they need to quarantine as a result of contact with you, the experience of monitoring yourself or being monitored by others for signs and symptoms of the disease. And I even just think about, when some of my children go to a different school than others, and how others parents may feel if we have a case and we're still sending our kids to the other school. Time taken off from work and the potential loss of income and job security. So again, we're just recognizing and understanding the feelings that we might have. So the challenges of secure things you need, such as groceries and personal care items, concern about being able to effectively care for children or others in your care, as a caregiver, and uncertainty or frustration about how long you'll need to remain in the situation. And I really appreciate when I hear both of you say this too shall pass eventually. But that uncertainty about the future is definitely a real concern. Loneliness associated with feeling cut off from the world and from loved ones, which ultimately is the subject that brings us together today. Just recognize we are social beings. And feeling lonely when you're isolated, is one of the things to recognize, at least. Anger, even if you think you were exposed to the disease because of others' negligence. Boredom and frustration because you may not be able to work or engage in regular day-to-day activities. That might even be travel. We mourn that for a time being. Uncertainty or ambivalence about the situation. Maybe you feel a desire to use alcohol or even drugs to cope. So symptoms of depression, such as feelings of hopelessness, maybe a change in appetite or sleeping. So it's you're moving towards success, at least by just recognizing some of these things, and we validate that.
So if I'm watching at home and feeling anxious or experiencing some of the things that you just talked about, Chandra, I think you gave so many examples about how we as people may be adjusting or not adjusting well to this new normal. And these are natural feelings, and everyone's going to react differently, and it might be different day to day. So if I'm watching this, what would you recommend as first steps, and where I could go, or where one of our viewers could go if they need help?
Right. So beyond recognizing it, as we just went through, share your concerns is really the next step. And that doesn't take, too much out of your day. Maybe it is connecting with a friend, or making a phone call. It might even be your neighbor as you're leaving the house in the morning. I know that I saw mine today, and I know last night my husband spoke with our neighbor, and it actually sort of lightened his mood. I could tell when he came in. It might actually be making an appointment with your healthcare provider, a pastor. Maybe it's also a mental health professional. And at this moment, maybe that feels overwhelming because maybe it's hard to get into a mental health professional, or maybe you can't go out. I want to mention that our state of North Dakota has a 211 number, and you can just simply pick up the phone and dial 211. And there you can actually reach out to National Suicide Prevention. They can connect you with those resources, give you phone numbers of individuals taking appointments. You can call 211 for confidential listening and support. So it might not just be to connect you to the National Suicide Prevention numbers, but just an ear on the other end of the phone, because we know that talking it out helps. You can call specialists who are trained in crisis intervention, and including, that subject of suicide. So reaching out, and just know that if you aren't able to go out, many healthcare professionals are doing virtual appointments.
I think that's not only important that we find ways to socially connect and stay visible with our family and friends, but I think healthcare providers have really tried to find innovative ways to make sure that people know there is someone to talk to even if you can't leave your home. I think that's a really, really great point, Chandra. So Katie, I'd like to bring you back into the conversation. I think reaching out and asking for help is such an important step, but it's a challenge. And so do you have ideas or tips for how folks can conquer or prevent loneliness?
Yes, I think there's a lot of factors that can play into this, and some of the things I'm going to list off, even if you can just implement one or two, I think you'll see a change in your mood, and then eventually things will kind of fall into place. So my first one I want to share is connect meaningfully, and I really want to emphasize the meaningfully in that, because although technology can help foster connections, it's imperfect, and there can be challenges. And so really think of ways that are impactful to you, and when you make those connections, make them count. Be thankful. And I think as we move into the fall and holiday season, really being thankful for where you are at. It's easy to focus on the negative, but when you look to express appreciation and gratitude towards others, it really can help shift your mood. And I know Governor Burgum has also talked a lot about gratitude during this time, and I think that is something that we really need to hone in on and be grateful for the great state of North Dakota that we do live in and the resources that we have available to us. Focus on what you can change and not what you can't. And so maybe there's little things that you can do differently. Spending time dwelling on the current situation is really going to just make things worse. And so trying not to necessarily ignore it, because we can't ignore something that is going on, but just look for other opportunities and other areas to draw your attention and focus to. Enjoy being busy. And so that maybe could be taking on a new task in your home or taking up a new skill. Just look for ways to kind of keep yourself busy throughout the day. And it can be little things that you can take on. This is an opportunity to maybe hone in on your creativity or branch out a little bit. Remove negativity from your circle, if you will. Surround yourself with positive people and engage with positive people. The negative, whether it could be social media or the news, if that's something that brings you down, then don't engage in it, and really just focus on the positive, and put yourself in conversations with positive people. Just the act of smiling can make your day and make you feel better. And so even smiling at others can really make a big shift for somebody or for yourself. Be kind, understanding, and patient. And what I love about this is be kind. I think I'm just going to say that. Kindness goes a long way. And so if we can just be kind to others and be kind through this all, it's going to make it easier on everybody and the community itself. And then look to develop a routine, having that kind of that next thing to look forward to. If you aren't able to leave your home, or if you are able to leave your home, but have certain things in place that you can kind of look forward to or have in place that is that next step. And so having that plan, it becomes more familiar, and it's something that you look forward to and can engage with on a daily basis.
Those are really great reminders, Katie. I often remind people that I'm around that, we just need to be patient and flexible with each other. And we never know what someone else is experiencing or what they might have been doing that day or a few days before. And I think being kind is a super important reminder. Are there other resources that Chandra or Katie that you'd like to share with our viewers if they're needing to reach out or find some ways to stay connected?
Yeah, I'd love to mention, AARP has so many great resources. And, I'm with NDSU Extension. I happen to be in Burleigh County. But if you were able to call an NDSU Extension office, all of our counties have an office, or even if you're on the computer, so many resources specifically about navigating this pandemic, whether it's emotionally or as we talk about being lonely. We even have resources about talking to children about the pandemic. And so many things that you could do. And if you're not computer savvy, please just call one of our offices. And, you may be a parent who is struggling because you might be in that vulnerable category because maybe you have a child who's at risk or something. And I also want to mention that parentslead.org is a website where you can go for a lot of these resources. Maybe you are a caregiver to a special needs child, as I mentioned. Our AARP website, as well as NDSU Extension, does have a program that you'll find out there about, tools for caregivers. That's actually the name of the program, Powerful Tools for Caregivers. So please reach out to us if you feel that you need help and, you're sort of at the end of your rope being a caregiver. And that might even be for your spouse too. So many resources with NDSU Extension, with AARP, and of course, parentslead.org if you're in that situation. So thank you.
Thanks,
and I would
Chandra.
just like to add, Janelle, that your local public health unit can help you connect with other resources in the community if you're facing challenges or struggles. So feel free to reach out while we are navigating and kind of the front lines during this pandemic in terms of a public health crisis. We do have resources available for the community, or can at least connect you with those organizations like NDSU Extension. And so please just call your local public health office and we can kind of connect you with where you would need to go.
You both have been just excellent resources to talk to today. I think we often want to just fix things ourselves, right? But I think what's important right now is to know there are others out there that we can reach out to. Like you said, if you're feeling stressed, if you're feeling lonely, isolated, or if you're a caregiver, don't hesitate to reach out. You've got 2 excellent resources here. They're located all across the state. You can also stay connected with us, AARP North Dakota, on our Facebook page. You can see all of our videos and trainings that we posted throughout the last 7 months. We have some really exciting stuff coming up, including some cooking classes. So check out our Facebook page. You can also check out all of our wonderful resources at aarp.org. ND. Thanks again, Chandra and Katie, for joining me. And folks, please stay connected with us here online, and we hope to see you very soon.